Beriberi, a disease of peripheral nerves caused by a dietary deficiency of thiamine, vitamin B. Symptoms include fatigue, diarrhea, weight loss, edema, heart failure, and disturbed nerve function. Coenzyme, a non-protein substance that combines with a protein molecule to form an active enzyme. Enzymes, specialized proteins that catalyze biochemical reactions. Fat soluble vitamins, vitamins that can be dissolved in fat. Minerals, inorganic substances that are ingested and attached to enzymes or other organic molecules. Pellagra, a disease resulting from a deficiency of niacin or a metabolic defect that interferes with the conversion of tryptophan to niacin. Rhodopsin, the purple pigment in the rods of retina, formed by a protein opsin and a derivative of retinal vitamin A. Rickets, a condition caused by a deficiency of vitamin D. Scurvy, a condition resulting from a deficiency of ascorbic acid. Tocopherols, biologically active chemicals that make up vitamin E compounds. Vitamins, organic compounds essential in small quantities for normal physiologic and metabolic functioning of the body. Water soluble vitamins, vitamins that can be dissolved in water. Chelating agent, drugs used to treat mental poisoning from iron, lead to mercury, from iron, lead, or mercury that bind to the toxic metal, decrease binding of the metal within the body, and promote elimination of the metal. Electrolyte, electrically charged particles found in body, fluid and cells like sodium and potassium ions. Internal nutrition, provision of fluid and nutrients to a functional gastrointestinal tract via feeding tube in a patient who is unable to ingest enough fluid and food. Fat soluble vitamins, vitamins that are accumulated and stored in the body when taken in excess. Hyperkalemia, greater than normal amount of potassium in the blood. Hypokalemia, less than normal amount of potassium in the blood. Malabsorption, impaired absorption of nutrients from the gastrointestinal tract. Megaloblastic anemia, anemia characterized by the presence in the blood of megaloblast, large abnormal blood cells associated with vitamin B12 deficiency. Megavitamins, large stores of vitamins in excess of the recommended dietary allowance. Parental nutrition, intravenous provision of fluid and nutrients to a patient who is unable to ingest enough fluid and food due to non functional gastrointestinal tract. Introduction of vitamin. The word vitamin was coined in 1911 by Warsaw born biochemist Casimir Funk at the Lister Institute in London. Funk isolated, Funk isolated a substance that prevented nerve inflammation, neuritis, in chickens raised on a diet deficient in that substance. He, he named that substance vitamin because he believed it was necessary to life and it was a chemical amine. The E at the end was later removed when it was recognized that vitamins need not to be amines. The term vitamin derives from the word vital amine, which means essential nitrogenous compounds. The term was coined by Polish scientist Funk, who gave the name vitamin to anti-beriberi substance. Later, E was dropped and thus the term vitamin was coined. However, with the discovery of more vitamins, it was soon realized that vitamins are not nitrogenous compounds, but all vitamins are essential for health. Vitamins are complex chemical substances required by the body in very small amounts. They do not yield energy but act as catalysts in various body processes. Since vitamins cannot be manufactured in the body at least in sufficient amounts, they have to be supplied through the diet. Vitamins are organic substances present in small amounts in food. They are required for the carrying out vital functions in the body. Classification of vitamins. Vitamins are involved in the utilization of major nutrients such as proteins, fats, and carbohydrates. Though needed in small amounts, are essential for health and well-being of the body. When these vitamins were discovered on the basis of their functions and before their chemical nature were elucidated, they were designed as a B, C, and D, or in terms of their major functions such as antiuretic, antirachitic vitamins. Vitamins are classified into two types: fat soluble and water soluble. Fat soluble vitamins are vitamin A, D, E, and K. Water soluble vitamins are further divided into two types: non B complex and B complex. The non B complex vitamin is vitamin C, and B complex vitamin is further divided into two types: energy yielding, energy releasing, and hematopoietic. Energy releasing vitamins are thiamine, riboflavin, and niacin, B1, B2, and B3, and hematopoietic, which are responsible for RBC production, are folic acid, means vitamin B9, and cyanocobalamin, vitamin B12.